Okay, my name's Monique and this is the SCC Injectable Checkoff. I'm going to start in the med room with patient verified MAR, patient name Manny Stickins, and we are giving the 0900 medications or injectables as well as the one-time dose of the Practi tub. Okay, starting from the top, Practi amp. So I have an ampule here, Practi amp, I need 1.7. This is a 2 ml vial, so this is enough for that. And expiration date is February 2029, so it is not expired. Next is insulin R. I have insulin regular or insulin R. I need 8 units. I have a 100 unit per ml vial, so that's enough for the 8 units that's needed, and expiration is February 2029, so it's also not expired. Next is insulin N, or practice insulin in PH. It's 100 units per ml. I need 12 units, and that's enough in this vial to get the 12 units. And expiration is February 2029, so it's also not expired. Lastly is the Practi tub. I have the Practi tub, PPD 0.1 ml. It's a 1 ml vial with 5 TU per 0.1 ml, so I just need 0.1 ml of this. And expiration is February 2029, so also not expired. Now I'm just gonna go ahead and gather my medications, my MAR, and move to the nurse's station. And before I go in the nurse's station, I'm just gonna get a close-up of the expiration dates on the vials. Starting with the Practi amp. Here's the Practi amp. Sorry, there's a little glare. It's very hard to get a good angle of this. And the expiration date is right there, which it says February 2029. We have our regular insulin with expiration date of February 2029 as well. We have the NPH insulin, which all of these are practices with expiration of February 2029. Lastly is the Practi tuberculin. With expiration February 2029, not expired. In your life, I would be very careful how I hold these vials by trying not to touch the top of them. Okay, so now I'm in the nurse's station for the second check. Okay, so Practi amp, I need 1.7 ml. I have 2 ml, so there's enough in here for the 1.7 ml, and it is not expired. For this, since it is 1.7 ml, it's too much for the deltoid, so we will have to go on the ventral gluteal, is by my choice, because I'm going to use a 3 ml syringe because it is calibrated by 0.1 ml, so it'll give us an accurate dose of the 0.7. A 21 gauge needle with 1 inch is the choice as well for the length, and the filter needle. Okay. So now that I did the second check on that, I'm going to just go ahead and get this ready. I'll attach the filter needle. I will not inject air since it is an ampule. We don't want to get any glass in there. And I just open this to get it ready. Go ahead and open an alcohol swab. Just look at the vial, make sure that you tap it to make sure that all of the excess fluid that's in here is actually on here. It's in the bottom of the vial. Now, you want to just go ahead, attach or put this on here, the alcohol swab, and break away from you or anyone else. Discarding the sharps, the top, and then the alcohol swab in the trash. And we are going to go ahead and draw up with the filter needle. 1.7. So I am going to overdraw this just to make sure that I get the accurate dose, and I will discard of the rest in the appropriate bin. Okay. So now I'm just going to put this back on here. Discard of the filter needle. Attach my regular needle. Just want to make sure that all the air is at the top of the syringe. And then we will go ahead and eject the air and get the appropriate dose. And I am over a trash can. So okay. So 1.7. Just going to just put that back on. Check my dose one more time. This can go in the trash. And we'll use the triangle method to label our syringe. Oops. Okay, Practi Amp. We had 1.7 ml. Expiration is 2029. Practi Amp, 1.7 ml, 1.7 ml, 1.7 ml. Expiration 2029, which matched that. Here is that Practi Amp. Just gonna get as close to the bottom as possible. Put that to the side and go ahead and put this in the discard in the sharps. Next is our insulin R, or regular insulin. I have the regular insulin. I need 8 units. I have 100 units per ml, and it is not expired. Next, I have the insulin N, or NPH insulin. I need 12 units. There's 100 units per ml, and this vial is also not expired. So this one, just want to make sure you definitely give it a good roll so you do not, so everything gets mixed up. Okay. So I have those, and then for the syringe, since it's an insulin, I have a 29 gauge 1/2 inch needle insulin syringe. It is 50 units. If I had a 30 units, I would likely use that because I need 20 units total, and it would be much more accurate. I'm going to just draw 20 units of air. I'm going to inject 12 of those units into the cloudy. And then I'll inject the other 8 units into the regular. And then I will draw the 8 units up of the regular. And then go ahead and draw the 12 units. Which will equal 20. units total. I'm gonna just go ahead and cap that back. And now we'll label. So I have regular insulin, and then I have our NPH insulin. And of the regular insulin, we have 8 units. Of the NPH, we have 12 units. And then both of them, it is a 100 unit per ml dose. Expiration for each is 2029 or February of 2029, and it is for both. Okay. So here is that label. Lastly, we need our Practi tub. So now I can just put this to the sides. The Practi tub, I have Practi tub, 0.1 ml. It's a 1 ml vial with 5 TU per 0.1 ml, and it is not expired. Okay. So this is an intradermal. For intradermal, you need a tuberculin syringe, which is a 1 ml syringe. And that's what we have here. This is a 27 gauge with a 1/2 inch of a needle. 0.1 of air into the syringe. Just inject the air. Go ahead and turn it over. 0.1. We want to make sure no air bubbles are present. Okay, and we will label this one as well. Using the triangle method. Practi tub with 5 TU, 0.1 per 0.1 ml. Expiration is February 2029. And going by here, we have Practi tub, we need 0.1 ml in our dose. And then just to verify, we have 0.1 ml. So the triangle method checks out. Here is that. All right, so now that we got all our medications, I'll take the MAR and all medications in these syringes with me to patient room. I will go ahead and put these medications and the vials back into the appropriate Pyxis where the facility or per facility policy, and make sure that I discard all of my trash per facility policy, which is in the trash here. Okay. Okay, so now I'm in the patient's room. I am just going to adjust the camera here. Okay, so I'm in patient's room and I just introduced myself. Hi, I'm Monique. I'm your student nurse today. How are you doing? Patient states they are good. If I could just verify your date of birth and your name, please. Okay, looking at the MAR and the patient's late or band. Manny Stickens, date of birth is 12/15/48, 12/15/48. And do you have any allergies, Mr. Stickens? He states he is allergic to penicillin, which we do have that in his chart, as well as all the interactions or what he gets when he takes penicillin. Okay, so today we are going to be giving you your your injection medications. Patient states he doesn't care what order he gets the medications. I just want to let you know with these, we want to make sure that you don't rub on the injection sites. And with the one that's going to go inside your muscle, it might be a little bit sore there. And for the insulin one, the tuberculin one, the one that's going to go in your forearm, just try not to scratch that, because it can give a false reaction if we do scratch that. Okay, patient doesn't have any other questions, so I'm going to go ahead and do my third check. Practi-Amp, 1.7 ml, 1.7 ml, and it is not expired. And looking at the syringe, I have 1.7 ml. So there is the one, it's a little hard to see, 0.7. Okay. Next is the insulin R. I have regular insulin, 8 units, and it is not expired. I have insulin in, or insulin in pH. I have 12 units, and it is also not expired. Together, they are the 20 units. And lastly, I have the Practi-Tub, 0.1 ml, 0.1 ml, and it is not expired. Okay. So again, patient states he doesn't care what order, so we will just start with the Practi-Amp, which is the intramuscular injection. We are going to go in the ventral gluteal. It will be the right ventral gluteal. We want to make sure we clean and use the Z-Track method. So after that dries, just pull the skin back, go at a 90-degree angle all the way down, and then we just want to aspirate. No blood is noted, so we can go ahead and inject that medication in. Pull the syringe out and then let the skin retract, ignite the safety, and it goes in the sharps. Again, just a little pressure, but we're not going to massage any of these injection sites. And again, you might feel a little bit of muscle soreness there. Next one is going to be in the patient's abdomen, 2 inches away from the umbilicus. We'll make sure that that is nice and dry. Okay, so we can pinch more than an inch of this patient, so we can go at a 90-degree angle. So we go ahead, pinch, we insert, we release, and then we let the medication go in. And then ignite the safety and the sharps. Go ahead. And that again was the right lower abdomen, 2 inches from the umbilicus. Lastly, we're gonna clean is the patient's right ventral surface of the forearm. Let it dry. This one, we're gonna pull the skin taut and make sure we're at a 5 to 15-degree angle and the bevel's up, and make sure that it is at least 1/8 into these, inside the 1/8 inch of the needle goes inside the skin, so the bevel is covered. We let inject. There is a bleb or a wheal. We take out, ignite the safety. And again, with this one, you want to make sure that you don't rub anything. Okay. So now that I'm done, I am going to go ahead and document. The Practi-Amp was in the right ventral gluteal. The insulins, right lower abdomen. And the amp was in the right arm or right ventral surface of the arm. We sign our name with SNSCC and then initials. Okay, lastly, I just want to make sure that I go over with patient to see if they have any concerns or anything. Patient states he doesn't have any concerns. I inspected the environment, everything was good. Call light is in reach, bed is all the way down to the floor. I let patient know I will be back to check on him within 1 hour, but if needed, he can use the call light, and that's it. So for those medications, just to make sure, again, for the intramuscular and the sub-Q injections, we could use it just depends on where we go on the injection site and how much fluid or how much medication we're going to draw up. Depends on, that's how we pick the syringe. And for the intradermal, it will always be an intradermal, a 1 ml syringe. And then that's it for the Z-Track. Again, we pull the skin away, we inject, we make sure that we let it go back. That way the medication goes all the way in. And for the subcutaneous, we pinch an inch. Because it was more than an inch, we can go at a 90. If it was less, then we go at 45. And then, and of course with the Z-Track, we want to make sure that we aspirate. And then that's pretty much it. With that, you pinch, you insert, you release, the medication goes in, and that's for subcutaneously. And I believe that is it.